The high costs of treating diabetes and the medical complications that it brings has the potential to cause major funding problems for the NHS. And now there's a cost-effective way for patients to easily and effectively manage their diabetes, developed by Nipro Diagnostics UK. As Joanna Simpson reports, self-monitoring is delivering reliable results and significant savings that have been successfully invested in service redesign across West Berkshire.
In Berkshire West, healthcare professionals say they're seeing a significant improvement in the management of diabetes. The Department of Health states that in the UK, the chronic illness is the leading cause of blindness among people of working age, the largest single cause of renal failure, and excluding accidents, is the biggest cause of lower limb amputation. It also costs the NHS more than £1.5 million every hour and accounts for 10% of the overall budget for England and Wales. As part of service redesign and care planning, the local clinical commissioning groups here have changed the supplier of their blood glucose level self-testing kits. They say they've seen a dramatic reduction in costs, which is being reinvested back into services.
Over the last 2 years, we've saved about £800,000 simply in prescribing costs. And we've done that at the same time as improving our outcomes. So we know that over the last couple of years, we have improved patients' blood glucose levels. We have improved dramatically their cholesterol levels and blood pressure levels. So actually, we're squaring the circle because we're making things better for patients, and at the same time, we're saving money.
You need to start testing your blood glucose levels on a regular basis.
Looking at the costs involved regarding self-testing kits was part of 3 big pillars of change: educating healthcare professionals, structured education for patients so they're able to manage the condition themselves, and care planning, which includes sending patients their results a fortnight before their annual review so they can assess their own condition. The government says self-management is the cornerstone of effective diabetes care.
It empowers people to be able to take control, and this comes with knowledge and information about the results and what they mean. I think the traditional models of care perhaps don't lend themselves to allowing self-management of long-term conditions. So we now have adopted this approach as a way of addressing the balance and making it more of an equal and collaborative consultation.
The overall result of a reduction in prescribing costs means Berkshire West CCGs have been able to invest in other diabetes services. There's now a diabetes specialist who visits surgeries to advise treatment for the most acute patients. This expert analysis at virtual clinics means several cases can be discussed and has the added benefit of increasing the knowledge of those at the practice.
So in a traditional clinic, you might see as many as 12 patients in the morning or an afternoon. In a virtual diabetic clinic, you'll be able to review upwards of 30 people's cases in a morning or an afternoon. So you're seeing more than twice as many patients' problems in the virtual clinic.
The number of patients achieving good control of their diabetes, he says, has increased substantially. Berkshire West has also introduced a diabetes specialist nursing service in the community. It has a better website for both patients and practitioners to use, and the system tracks changes across the area.
We've got a diabetes network set up, which is a multidisciplinary group, and it's to look at all of the processes around diabetes. And within there, it's trying to make sure that we can give the most appropriate treatment to the most appropriate patients, and making sure that the patients are well managed. We can put in appropriate services to help to maximise on the limited resources that we do have.
Berkshire West is sharing its approach with other CCGs. It's hoped continued streamlining will see even greater benefits over the long term.